One of the biggest questions that people coming onto Medicare face is, should I go with a Medicare Advantage or a Medicare Supplement plan? Hey, we're talking about the pros and cons of each approach today, and to help you maybe make a better decision about which one is right for you. Hey, come on in. Let's talk Medicare 101 today. One of the biggest questions I get as a Medicare agent is, should I get a Medicare Supplement or a Medicare Advantage plan? And we're going to talk about the pros and cons of each of those options right now. The first decision that you're going to make as you're coming onto Medicare is which route you want to go, because Medicare gives you a couple of options on how to offset the medical costs that are associated with original Medicare. Option one is a Medicare Supplement plan. Option number two is a Medicare Advantage plan. And so these work very differently, and oftentimes people are looking at this and they're trying to figure out which one is the right one for me. So let's give you some of the pros and cons on each of these, and maybe that will help you to make your final decision. Just a word as we begin, I'm an independent Medicare agent. I don't work for any Medicare company, I don't work for Medicare, and I'm not married to any of these particular routes. Whether or not a person goes with a Medicare Supplement or a Medicare Advantage really doesn't matter to me, because I'm trying to find the right fit for your situation. And that's not always the same thing for everyone. With the Medicare Supplement, you have some very significant pluses on this. Number one is maximum flexibility. There are no networks with a Medicare Supplement. Any doctor that accepts original Medicare will accept your Medicare Supplement plan. There are no networks to worry about. There's no restrictions on doctors. So if you are looking for the most flexibility on where you get your health care, a Medicare Supplement will give you that. Number two, unlike a Medicare Advantage plan, Medicare Supplements generally do not have prior authorizations. Original Medicare generally does not, and that means your Medicare Supplement does not either. So you're not going to find yourself going on your doctor's instructions to get an MRI only to have the insurance company say, hang on, we got to get prior authorization, and run the risk of the insurance company say, hey, we haven't done an x-ray yet, let's start with that before we get to the MRI. That can happen with a Medicare Advantage plan. That will not happen with a Medicare Supplement. Number three, you could have lower out-of-pocket medical cost. Generally, on a Plan G or a Plan N, you're very limited on what you're going to be paying out-of-pocket. With both of them, they're going to cover almost everything except for the Part B deductible. Now in 2021, that's only $203. Now that can go up year to year, but that is the Medicare set deductible. It's not set by the Medicare Supplement insurance company. Once you've met that with the Plan G, you don't pay anything out of pocket. With the Plan N, you may pay a couple of co-pays for your doctor visits, up to $20, up to $50 if you go to the ER. But apart from that, it is very simple, and you're going to get a lot less billing. So in trying to figure out how much you owe to who is a whole lot easier on a Medicare Supplement than sometimes on a Medicare Advantage plan. Now, there are some cons with a Medicare Supplement. Number one, they don't include prescription drug coverage. You would need to get a separate Part D prescription drug plan and pay that additional premium to go along with that. Number two, they don't cover any additional benefits. So dental, vision, and hearing, if that's important to you, chances are Medicare Supplement is not going to have coverage for dental, vision, or hearing, and you would need a separate plan with a separate premium for something like that. And again, Medicare Supplements don't cover things that original Medicare does not cover. Medicare Advantage plans also have some pros and cons. With a Medicare Advantage plan, one of the biggest pluses is that they have a low to no monthly premium. That means that once you paid your Part B premium, if you have a plan available in your area that's a $0 premium, you pay nothing else for that Part C Medicare Advantage coverage. And that could include your Part D coverage in there as well. And that's the second of the big pluses on a Medicare Advantage plan. Most Medicare Advantage plans do include your Part D coverage in that same low premium. There's generally not an additional premium for the Part D coverage. So if you do have a zero premium plan in your area, that means you can get your medical coverage and your prescription drug coverage at $0 per month. That's a nice perk. Number three is that they can often cover some additional things that original Medicare doesn't cover, like dental, vision, and hearing. These can be great benefits as you're in your senior years, and they would be included in that same zero premium dollar plan if that's available in your area. If it's not, there may be a low-cost Medicare Advantage plan that you have there. If you want to find out what plans are available in your area, just give us a call. We'd be glad to look that up for you. But there are some cons to a Medicare Advantage plan. Number one, you do have doctor networks that you need to consider. It does limit your flexibility. Now, some plans have a lot of flexibility in their networks. Doesn't mean that you're going to be severely restricted. Many plans have very large networks to work in, but that may limit if there is a special cancer hospital that you want to go to. If that is not in the plan's network, you would not be able to access that on your plan. You could on a Medicare supplement. You may also have prior authorizations. Prior authorizations are where the doctor's office has to get permission from the insurance company before they do a certain test or procedure. So take, for example, that MRI that we mentioned. If your doctor sends you to go get an MRI and you're on a Medicare Advantage plan, generally speaking, most plans are going to require prior authorization for something like that. And it could be that the plan says, hey, let's start with something a little bit lower cost first, and that's to save you money and, quite frankly, to save them some money. And they may have you get an x-ray or something else before you get the MRI. That could mean a little bit of a delay. On a Medicare supplement, you generally don't have those delays in getting the procedures that you need. You also have the possibility on a Medicare Advantage plan of having a claim denied. So all of these are possibilities on a Medicare Advantage plan. So when you're thinking about, should I go with the Medicare Supplement or should I go with the Medicare Advantage plan, it really comes down to some simple choices. Number one, can I afford the monthly premium of a Medicare Supplement plan? Medicare supplements do have a monthly premium, and that is a con for that. You pay that every single month, whether or not you are in good health or bad health. So that means that in a good health year, you could be paying those premiums every single month and feel like, why do I even have this? On a Medicare Advantage plan, if you're in relatively good health, your healthcare costs could be significantly lower because you don't have the monthly premium and you may have low copays when you do access healthcare. So for a person that's in generally good health, Medicare Advantage might be a good fit. However, for greater peace of mind, the Medicare Supplement could be a good option to go. If you have a bad health year, a Medicare Supplement is going to feel really good because you pay your monthly premium and you have very low out-of-pocket cost. If you have a bad health year on a Medicare Advantage plan, you could be seeing out-of-pocket cost all the way up to the plan's maximum out-of-pocket. For 2021, Medicare sets the maximum out-of-pocket at $7,550. So that means that your healthcare costs could range anywhere from zero on a Medicare Advantage plan all the way up to $7,550 in a calendar year, depending on what the maximum out-of-pocket is for the particular plan that you are on. When you're on a Medicare supplement and you have a bad health year, you have your monthly premium, and if you're on a Plan G, the only thing that you're paying out of pocket is the $203 Medicare deductible, and again, that's for 2021. So for someone that is coming into Medicare and you know that you have some health issues, if you've got a lot of health issues, it is worthwhile to consider getting a Medicare supplement and a Medicare Part D plan. However, if you're on a limited budget, maybe a more modest income, it may be a clear decision to go with the Medicare Advantage plan. Both of these have pros and cons, and we would certainly be glad to help you walk through which would be the right fit for you. Generally, sometimes just having those kind of numbers of how much the premium is for Medicare Supplement versus a Medicare Advantage is the deciding factor for some. For some, the health conditions can be the big deciding factor, and you go with a Medicare Supplement over a Medicare Advantage plan. But if you're really needing to compare the two, we'd be glad to sit down with you virtually or over the phone and let you know how much Medicare supplements are in your area, how much Part D plans are so that you can know what the premium would be and what the coverage would be in your area versus a Medicare Advantage plan. And we can do a side-by-side analysis for you to let you know the ins and outs, the pros and cons of both, so that you can have the greatest peace of mind going into your Medicare years. Here's a pro tip for you. When you're making that decision, you may not be locked into one path or another for the rest of your life. There may be an opportunity for you to go from a Medicare Supplement to a Medicare Advantage plan, or from a Medicare Advantage to a Medicare Supplement. Medicare does give you that opportunity to kind of test drive those and see which one might be the better fit for you. What I would recommend is that if you're pretty evenly balanced between the two, start with the Medicare Supplement. It is very easy to move from a Medicare Supplement over to a Medicare Advantage plan. There are no underwriting questions on a Medicare Advantage. Big plus in that favor. However, later on, you may be able to move over to a Medicare Supplement from a Medicare Advantage if you can pass the underwriting questions. Now remember, when you're just turning 65, you can sign up for any Medicare Supplement that you want to, or if you're just retiring with no underwriting questions. So that gives you the complete flexibility to choose the plan that you want. And with the Medicare Advantage, anytime that you have a valid enrollment period, you can sign up for that. And again, no underwriting questions. So you do have the option of possibly choosing one or the other and then switching over within that first year or maybe later on, particularly if you're moving from a Medicare Supplement over to a Medicare Advantage plan. So don't feel like you're locked in right away. You do have an opportunity to test drive there. If you've got more questions about how Medicare supplements work and Medicare Advantage plans, what they are, give us a call. We'd be glad to do a personalized consultation for you, free, no obligation, so that you can know what your options really are where you live. Hey, I'm Randy Bond, independent Medicare broker. Thank you so much for joining us today, and we'll see you next time as we talk more about Medicare.